Right?
If I can have my slides, I understand, Catherine, you're going to help me with that, no?
Yes, so Alejo is gonna have your slides up. Does everyone see the screen of the slides? Okay, perfect. So we're happy to have Juan Manuel Sotelo here with us today. Before we begin, let me give you a little introduction to our guest speaker. So Dr. Juan Manuel Sotelo is the Pan American Health Organization and World Health Organization Director Sub-Regional Program for Central America and the Dominican Republic. Dr. Sotelo is a senior international public health professional who has devoted his career to promoting equity, development, and universal health. An experienced director of national and cross-national programs throughout South and Central America and the Caribbean, he has overseen the political, technical, and managerial aspects of PAHO and WHO operations in Bolivia, Mexico, Argentina, and Chile. He held similar directorships for the Eastern Caribbean and currently serves as the PAHO and WHO Director Sub-Regional Program for Central America and the Dominican Republic. He has also been the head of the Department of External Relations, Resource Mobilization, and Partnerships. We're very happy to have him with us today. And Dr. Sotelo, please take it away.
Thank you, Catherine, for this presentation. Well, I was recruited by Miranda, no? who invited me to join this crowd. And Miranda, in her invitation, she stated some lines about the type of things you would like to be informed about during this session. So I have chosen, I would say 80% of the lines that she suggested. So I'm going to follow that script, generally speaking. Give me the next one, please, Catherine. Well, this photo, and I'm going to present many photos. No, the previous one, I want to explain about the photograph. Yes, this is Paracas. Paracas is 3 hours away from Lima. And my daughter, Anna, she is a professional photographer. So she took all the photos in my presentation. You know, I show this because nature is always has been a good source of inspiration for me, you know. I love this part of the southern section of Lima. It's 3 hours away. It's a desert together with water, the sea, and then the coastal area. It's very special. Next, please. So the plan for this session is to have a brief introduction, basically about myself. Then I'm going to tell you about my academic training and skill sets, the way I see them. Then how to collaborate across fields. This is one of the things that you have requested me to cover. I'm going to speak a few minutes about work and life balance in global health. And then how is the nature, non-linear nature of a career in global health, and then the way forward as I see it. Next one, please. Okay, so I was born in Peru. I studied medicine, then specialized in public health, and I have 3 children. I was married, happily married for 25 years. Then my wife died. I have been a widower since 2009. Not a fanatic, but a widower. I have had some experiences trying to remarriage, but I finally decided not to do that. Maybe when the right person shows up, I will take that decision, but not yet, because I'm still a single now. I'm living in Panama. I have been here since the month of January, mid-January, and I plan to stay a few more months here. I came from Philadelphia, where I moved to Philly because my son Sebastian, he studies his MBA with you there, Wharton. He asked me, that he wanted to live with me while in Philly. So I left Washington, D.C. and moved to Philly. Remember, we still are in the middle of a pandemic, so I didn't have much things to do in Washington initially. So I moved to Philly. I was delighted living there for almost a year, last year. And what else I was invited to join the faculty as associate scholar. So I moved from Philly to Panama to accept this invitation that WHO has sent me. And that's about it, you know. And then my professional information, I am a medical doctor. I graduated in 3 countries. I started my studies in Peru, in Lima, in University Cayetano Heredia. Then I moved to Chile because my father, who was a doctor also, he had a long career in public health and in the World Health Organization as well. So he was posted as country representative in Chile. And I was the only child, so my mother made the pressure for me to move to Chile. So I transferred my studies from Lima to Santiago. And then I did my first year of professional practice in Venezuela also, because I was following my parents at that time. Then currently I'm in Panama, I told you that already, and the position I have is called Director of CAM, CAM, that's the Central American Subregional Program of PAHO WHO for the subregion of Central America and the Dominican Republic. They always separate the Dominican Republic from the subregion of Central America. I don't know why, but there might be historical reasons. Of course, it's part of the Caribbean, the Dominican Republic, not part of Central America, but they go along together in political, technical aspects, and many other aspects that are very important to highlight how many things are affecting your work in global health. Then my association with PAHO WHO is being a long association for 38 years, and I'm going to tell you how this association was built up. Okay, next one, please, Catherine. Oh, this is Lima. I was grown up here in this city, the capital of Peru. I can see my apartment from here. It's next door to the tennis club and overseeing the Pacific Ocean. So this photo has been taken by my daughter with her drone from the Pacific Ocean to the area where we live in Lima, okay? So she still lives in my apartment. She's a very lucky person. And so this is Lima, the capital of Peru, okay? I went to school here. I started my medical studies here. My first love came from Lima. And I always go there, at least once a year. I haven't been there for a couple of years because of the pandemic, but I should go anytime back there. Next one. Okay, I have selected the places where I have worked in the Americas, and I will try to give you a couple of lines from each of the places I have been working in health, you know, in public health as well as in global health, for you to have an idea of the type of things that you do when you are in a career in global health, okay? So in Lima, not really in Lima, but in Peru. I started my work in Peru as a young doctor in Cusco, in the area of Cusco, in the highland. Remember, I will tell you that afterwards. You know, I studied medicine, I told you already, in 3 countries, and then I moved to Baltimore. I did my master's degree in public health. And then I returned to Peru. When I returned to Peru, I was posted in the highlands, in Cusco, and I was dealing with public health programs because I already was specialized in public health in Hopkins. And then I learned how to work with some public health programs like tuberculosis and malaria. This was very helpful. It was a hands-on experience, and I was dealing with different teams. I learned how to relate again to my own country in the interior, as well as to different type of people committed to public health programs. It was a learning experience, really. Then I accepted a position in the central level of the Ministry of Health in Lima, and I had very high position very soon. So I learned in that position how to deal with a practical approach to primary health care, and as well as to work in international cooperation. So that was the main lessons I have had in working in global health in my own country. Then I accepted the position in WHO in Barbados, covering the 9 Eastern Caribbean countries. The 9 Eastern Caribbean countries are really 7 countries, independent countries, plus the dependent territories of Anguilla, British Virgin Islands, and Montserrat. No? So the main lesson working in the Caribbean, of course, when you listen to someone that has worked in the Caribbean, you think about paradise, no? Okay, paradise is a good place to be, definitely, but it has its problems. The main lesson I have is that each country is different. You cannot treat all the countries equal. No, each of them have its own history, its own personality, its own health problems. And I learned also the value of conducting health situation analysis in each of the countries. For me, it was very important because it gives you really the background and the soil where you can stand up and to build technical cooperation with these countries. So I learned about the value of health situation analysis, as well as to organize the first program of common health services. You can imagine countries like Dominica with 50,000 inhabitants, and countries like Anguilla with 8,000 and so on, or St. Lucia with 100,000. They cannot have medical specialists in all of them. So we developed a program of common health services that was very helpful for them, in which you really define where the specialists were located for treatment and for consultation and so on, and we work with them as a single functional unit to deliver health services, specialized health services. So this was a very practical game also I had while working in the Eastern Caribbean. Then I moved to Bolivia. I was getting more credentials in my own organization. In PAHO WHO, I was head of mission in Bolivia. And in Bolivia, I learned about decentralization. And there was, during that time, a lot of misunderstanding about what decentralization was. So very frequently, the national authorities tried to depend on me to convey the message, because those were times of political instability. So the credentials of PAHO WHO were very high, and so that they believe in what the representative was saying, and not really what the different groupings of people in the country were conveying. So those were years of decentralization, the value of working together, different things, trying to have a good technical cooperation for the country. Also, I have to recognize that I learned a lot. To have reliable information is very important. Okay, again, what I learned in the Caribbean was the value of a health situation analysis. In Bolivia, it also pays a lot to have a good analysis of the situation, a good analysis of the context. Then I moved to Mexico, again, as representative of PAHO WHO in Mexico. Mexico is a country with a strong health system, a very long-term tradition of working in health, great specialists, great health system, different social security schemes, and so on. But those were the years of NAFTA, okay, the North American Free Trade Agreement. And I jumped into the NAFTA agreement and try to promote the participation on health with good successful results so far. So we work with different ministries in Mexico and with the group that were negotiating the NAFTA agreement with Canada and with the US. It was very good, you know. And then I'm trying to convey the message that once you are working in international health, in global health, you have to be related to many people, many interests, many parts of society that are interested in the type of work you are doing. And you want to see, of course, health as part of the photograph. You don't want to see health in a marginal area. Then I moved to Washington, D.C. as head of strategic planning. Those were the years in which I was involved in the vision and mission exercises. This is very important and very helpful because it helps you to clarify for yourself and for your institutions which are the directions that are worthwhile to follow. No? For instance, I was named director of strategic planning, but you know, when I went to look what a strategic is, strategic means many things, is a polysemic type of term, you know. So I decided to use my own definition of what a strategic is. For me, strategic is what is important, okay? So you have to separate what is important and what it is peripheral, no? So it was a good definition. It helped me to define products and services in the type of work that PAHO WHO was doing in the Americas. And this is related to a budget, which is good also. It was a good association. Once you have the vision, the idea of where you are going, you define very well in a participatory manner what is the mission of the institution. Then you have to say what is A, what is B, what is C. There's a matter of priority definition, and you have to do this with the member states. You cannot do this just alone in the secretariat. So it was a very interesting exercise. At that time, I was also the chief of cabinet of the director of the organization. So that gives me the wider spectrum of the operation as a whole, no? Which was very good. These were the years of the renovation of Health for All. You remember the primary health care meeting? It's a must that you should know this history of public health. It comes from the year 1978. 1978, the countries of the world get together in Alma-Ata, in Kazakhstan, the former Soviet Union at that time, and decided that the way to go towards health for all was following the strategy of primary health care. So primary health care has been a sort of major philosophy or major approach for people in public health, and it still is, you know. So when I was in Washington, then we're talking about the 90s, 95, 96, 97. We were approaching the year 2000, and there was a goal in WHO that at the year 2000, everybody will have health for all. So we needed to review the status of health for all in the world, and I was the coordinator of that exercise for the Americas. So it was very, very, very important because we, again, we're trying to really find some good clues, data and information to see how does the Americas stand in terms of attaining health for all. That represented to work with indicators, to work with the way you are really fulfilling those indicators towards the goal of health for all. Certainly, we made a lot of progress, but at the year 2000, it was not possible to have health for all. But it still is an inspirational goal, and it still is being a sort of a light beam for people working in public health. Then I moved to Argentina, again as a country representative for Argentina. Argentina is a place of tango, wine, great wine. And of course, they have a lot of passion. These are people very passionate, and they had a political and social turmoil the years I was posted there. We are talking about the year 2000, 2001. I stayed there 6 years. It was a terrific experience, very, very nice. And I learned a lot about building back the faith of the population, because they had this major crisis in which the banking account of people were frozen. You know, it was very, very difficult for the general population to believe again in their country and to stand up to the type of things that a country is supposed to do, you know. So I had the negotiation table in health together with the other UN agencies. I was in charge of health, other agencies were in charge of other aspects of society. And so we built tables of dialogue in which we decided, together with the population and the representatives from the different groups, what type of things to do next. No? That they were all depressed. You know, it was a very interesting experience. May I have the next one, Catherine, please? Then from Argentina, I moved to Chile as country representative. And in Chile, they had those years the PAHO plan. It was a plan in which the state guarantees a number of health interventions for everybody. You know, it was like a common ground of things that the health system was obliged to do for the population. So it was very interesting. It was Chile always has been a highly politicized country. Politics were very much present there, and Chile were the years of sustainable development. We were talking a lot during those years about the value of the environment and the value of working for the next generation and so on. So I associated many things I was doing in Chile with our WHO center in Kobe in Japan. And we developed many projects and interventions associating the environment together with health interventions. Then I moved to Washington, D.C. as head of strategy of external relations, resource mobilization, and partnership. I was the director of these aspects there. Very interesting. The type of things I would like to convey for you is that during those years I created the mechanisms for coordination among main partners of the organization. The resource mobilization was mostly oriented towards funding from the member states, of course, their quota contribution, but also from funding from the US, from Canada, and from Spain. So I developed a sort of club of these main sources of cooperation that we have in PAHO. And we developed a mechanism for communication horizontally in a very transparent way. It gave us a lot of credibility and transparency in our operation, which was great. I also created the Partners for Non-Communicable Diseases, a Partners Forum. I worked this with the World Economic Forum in Europe, and it was very good. I'm trying to highlight for you the different dimensions in a career in global health. You know, now I'm working transnationally. I created an office in Brussels also, another one in New York, in addition to the one we had in Washington, to start working more closely with the European Union and different partners over there. Those were the years in which we were, because of my function, highly associated with the Summit of the Americas. This process was very important. It's a process that takes place through a summit every 4 years. This year, the Summit of the Americas is going to take place in Los Angeles, and the United States is the host country. It's very important because all the presidents and heads of states of the Americas goes to this Summit of the Americas, and they define policies. It's like a major market for cooperation, and it's a very important process. I participated in the ones that were hosted in the Caribbean, in Trinidad and Tobago, as well as the one that was hosted in Chile, and another one that was hosted in Lima, Peru. So I participated then with the OAS in this Summit of the Americas process. The other thing is the work with the OAS. It was very important in Washington. You know, the Organization of American States is a very highly political body that has its headquarters in Washington. So PAHO is the specialized agency of the Inter-American system. So I work with that system as well. In addition, of course, of being part of WHO. And being WHO means part of the health systems in the world, in the United Nations. So in this case, PAHO has that privilege to be in both systems, in the Inter-American one, as well as in the UN system. Then from Washington, I formally retired from PAHO. This was in 2012. I formally retired in August, but immediately I became engaged in other aspects of my personal life. I created a business, an LLC, a corporation, in consultancies in health and development, with based in Washington, D.C., but with work in many countries, and still my LLC is going on well. And I also created an NGO called GIA, Global Health International Advisors. This GIA is an operation that is taking place in 20 countries so far now. We have more than 100 members of former colleagues that have worked in development in the World Bank, in WHO, in PAHO, in the IDB, in different institutions that work internationally. And it's also based in Washington, D.C. Currently, I am the vice president, as well. I was the founder president of that NGO. And we still have a lot of work to do in many countries in the 5 continents. You know, we have people working for us in the Philippines, in Africa, in Naples, Italy, some countries of the Americas as well. So then I was invited again by PAHO WHO to be the director of BIREME. BIREME is a center in Sao Paulo, in Brazil. Why they invite me? All these series of commitments I have after my formal retirement with WHO is because they want me to solve some problems, okay? So they invite me to be director of BIREME because BIREME is the specialized center of PAHO based in Sao Paulo that has to deal with health information, okay? So this institution was hosted in a federal University of Sao Paulo. We were not getting along well. We had a 25-year relationship with the university, so I had to break that relationship because after my assessment, I said, no way, we cannot stay here. We need to move forward. So I moved premises in the city of Sao Paulo to new premises, to another facility. And from then, we started to develop BIREME again. It was a big lesson. We went back stronger. To live in the city of Sao Paulo was a whole experience. You know, it's like the New York of South America. It's a great place to live, full of art, full of major urban problems and so on. But it was a good hub for information. So we keep our center there, and the center is stronger now than when I took it at the beginning. Then I was invited to go to Mexico. Mexico was in a transition from the political transition from the PRI, which is a traditional party that has been in power for 70 years or more, to a new situation. But these were the years in which we were switching from the Millennium Development Goals to the Sustainable Development Goals within the UN. So it was very interesting how to be part of that process from a country that was heavily involved in international process like Mexico. So we managed to approve the Sustainable Development Goals with good country participation. Then I was invited to go to El Salvador as coordinator of CAM. CAM is the sub-regional level that PAHO has for Central America. There are other 2 sub-regional levels, one based in Lima for South America, and another based in Barbados for the Caribbean. In the case of CAM in El Salvador, I had a cadre of technical people that were dealing mostly with the integration mechanisms in Central America. This is Comisca, the Commission of Ministers of Health, then the Ministers of the Environment and so on. So it's working not country specific, but looking at the 8 countries together, the 7 Central American countries and the Dominican Republic. Okay, and now I am posted in Panama because we changed the CAM, this sub-regional program from El Salvador to Panama in order to be more strategic and more political in nature. So we have to deal now with interministerial meetings, with presidents, with the foreign affairs ministries and so on. So this is really an evolution of the type of work I have been doing in global health, now looking countries more as blocks than country-specific operations. Okay, may I have the next one, Catherine? Oh, this photo is fantastic. It is from the Uyuni Salar in Bolivia, at 4,000 meters above sea level. I went here with my family. It's an incredible place. You don't think that you're in planet Earth, but it's somewhere else. May I have the next one? Okay, so I'm a medical doctor by training, and I did my MPH in Hopkins, and I did a doctorate. I have a PhD in political science. So this association of public health and political science for me has been key in developing the type of things I have been doing in my professional career. It's very important to understand the political process that are taking place, to see the historical dimension that have taken place in the world regarding the main thinkers and so on, and how this is being implemented. My thesis, my doctoral thesis was on biochemical and biological weapons. So it was very interesting because I was immersed in the chemical war, all these aspects that add many things for my formation, my personal formation. And now about the skill sets that I have for working in global health that I value the most is to be a team player. You cannot work in isolation if you work in global health. There are personalities, but you need to learn how to work with all type of personalities and try to be part of a team. This is very important. Now, I am an organizer among countries because many programs I have developed are taking place in different countries, and it has a value added when you compare your experiences in one country with another, or when you look at a set of countries doing the same type of thing with common goals, and defining maybe strategies country specific, but common goals. You know, this helps a lot, you know, to work across countries. Then to be a strategic planner, I told you what strategic is for me, and it's maybe there are other people that cannot agree with me what strategic is, but for me, strategic is important, and then you define how do you position yourself in what is important for you and for your work setting. You need to have passion for something. In my case, it's passion for equity and for inclusion. I think these are two things that are very important for me. They are like a sort of horizon in my professional life. And then you have to believe in something else. You know, I believe in health for all. So I put my efforts towards universal health, and universal health is a transition of what we approved in the world in 1977 as health for all. So everybody has the right to health. I think, I believe in that. And now it is being called universal health, but it's basically the same thing. May I have the next one, Catherine? Okay, how to collaborate across fields, because you have to collaborate across fields if you want to attain some results in health. Of course, you have to be convinced of the intersectoral nature of health. This means work with many disciplines along the whole spectrum that you can imagine, not from doctors, nurses, anthropologists, but you need to expand this to people that are in agriculture, that are in health, that are in different type of society, because we have learned also working in health that you need to to take into account the social determinants of health and other determinants like the political and economical determinants of health. If you don't have a sort of peace in the type of things you do, if you don't have tranquility of having a good nutrition or at least possibility to access to a good salary or to have entertainment, you have to combine all these things that makes the day-to-day life. And these are in different places, not only in hospitals, in health centers, or in academia, just isolated in a silo. No, you have to work horizontally, okay? So you have to be convinced that intersectoriality is good. And it pays, it's a practical type of approach. Now, be open to other ideas and positions. This is very important. The world, as each of us live every day, is full of different points of view, of different solutions, you need to be open to what they have to say. All this digital approach now towards life, there is a progress in technology. We talk a lot about artificial intelligence now. We talk a lot about digital literacy, etc. So we have to be open to these new things that are taking place. And then something that is very important when you sit at a table and you want to get something done, you have to negotiate, but it's not good to negotiate by position. When you are working in global health internationally, you may have an idea, okay, I have this position and I want this position to prevail. That is not good. The best thing, and my advice to you, is to find which are the interests you and the other people that are around you for the negotiation are looking for. If you put the interest of people up front, if you identify what is the interest between your country and mine, what is the interest between your institution and mine, it is easier than if you go, okay, I want this position to prevail. No, go around interest, not around position. The other thing is you have to understand what is the national interest. If you are representing the United States, you have to know what does the United States want international in a specific forum. If you are going to the World Health Assembly, for instance, you need to clearly know what does the United States, if you are part of that delegation, wants out of me representing the United States in the World Health Assembly. Or for instance, if you are in a technical discussion also, it's good to know about vaccines or about treatments, about any matter. You need to know what does your institution wants out of you, going from the national interest to what your institution wants. But if you work in an international organization, society, in the World Health Organization, the national interest is just a reference. You need to understand what is the common good for everybody, the national interest comes down, but the interest of everybody comes up, okay? Then think about what is a global good, think about things that benefit the major amounts of people. It will benefit the world, it will benefit the Americas, it will benefit Central America. Not really what Guatemala wants or what Panama wants, but what is the approach for everybody that will help society as a whole. Okay, so it's different then. But it's important that you know what is the national interest. In your case, where do you place yourself in the world? In which institution are you working on? And what is the interest of everybody when you work in an international organization? Then you have to play the game of diplomacy, of course. Soft diplomacy is that related to health, is that related to art, is that related to education and so on. But hard diplomacy is the one related to peace, war, money, which is different, okay? So you sit at a table, you have to understand very well if you are part of the soft aspect of the negotiation or if you are part of the hard aspect, okay? But health normally is a soft part of the negotiation of any type of activity in the UN, any type of activity in diplomacy in general. Okay, if you talk about war, peace, money, then you are in the hard part. Okay, Once you know that, you know you will know how to navigate. Next one. Oh, I love this. Next plan, please. Okay, now suggestions for work-life balance in global health. It's important that you define your personal and professional goals. What do you want to be? This is something I have asked Miranda the other day. In 10 years from now, how do you see yourself? This is very important. You have to have an idea. What do you want in 10 years from now? What do you want at the end of your career? What do you want when you are in your maximum, and so on, as a persona and also as a professional. So try to have an idea of this, okay, which is your personal goal. You want to be rich, you want to be poor, you want to be recognized as someone that has made a contribution in global health, you want a Nobel Prize, what do you want? Okay, you want to be a mayor, you want to be a scholar. This is important that you define what do you want in your personal life as well as in your professional setting. Then it's important also to assess the context every day. I spend at least 40 minutes to 1 hour reading the major newspapers that inform me what's going on in the world. You can do it very easily. If you go to kiosco.net, for instance, KIOSKO.net, you will have all the newspapers of the world, and then you decide which one do you want to review every day in these 40 minutes I'm recommending you to do, because it will give you how the world stands in this particular moment, at least from the point of view of the journalist, but you can choose, the type of media you want to have at hand, to be informed of what's going on in the world. Then you have to identify also how your institution is performing. If you work for academia, University of Pennsylvania, you want to know how the University of Pennsylvania is being recognized, with their peers and so on. What about the scales? There are many scales that are being in place to give credits to an institution and so on. If I work for WHO as well, I'm interested to know the opinion of some people that have said maybe that we have not worked enough to condemn some countries for some positions they have taken initially at the beginning of the pandemic. How are we doing? And so it's very important to assess also honestly how your institution is performing. You will feel better, you will know how to contribute better, we will know how to adapt to the situation that the institution is going through. And then draft a personal agenda with a spirit of unity of life. It's not good to separate your physical life from your activity professionally from your family life. You are a person that has many aspects in your life. Try to put these pieces together, your mental health, your relationship with your peers, your training, your sport activities, and so on. Be oneself. You have to be yourself, but all these bits and pieces that is equal to a human being today, March 22nd, and so this to be put together. And then talk to your family as frankly as you can. You can imagine in my career of 38 years, I told you about my 3 children. But all these 3 children, they were born when I was working for WHO. They were working on the road, and they have been to school in many countries. So this is not so easy, to move a boy or a girl from a country to another when they have friends, they have relations, they have their tastes and so on. So I have had this sort of struggle with my family. You need to convince them nicely what's your next move professionally, because they are part of your personal unit of life. This is your family life and so on. Being the part of that, you have to give them the time and the dialogue that they deserve in order to move in your career when you work in global health. This is very important. Next one. Okay, and now there is a non-linear nature of a career in global health. Of course, you have to be open to opportunities. My specialty in public health is epidemiologist, but suddenly I found myself working not with health programs like initially tuberculosis or malaria and so, but I was more involved in defining policies, in management. So you have to be open to these opportunities that they will be in front of you suddenly, not always programmed, but you have to be very open because these things just take place and you have to take it or not, no? Okay, the world is more than your current job. Of course, you have a job doing your job description as well as you can, but the world is wider than that, you know? You are part of society, you are part of an institution, big or not so big, but it's wider than what you have in this moment. So you have to be very conscious about that. And my advice is that loyalty pays. It's important to be loyal with your institution because then you will be recognized as someone that makes good contributions trustfully, and that you can be a person that could be called when things are not so easy. And then learn new skills. This is important because the world of health, the world society is changing. You have new technologies. You have to learn a new language also to move easily in development. You have to learn many things that are useful in your career in global health. And be available when the need arises to not only to make contributions, but to maybe help others and to continue doing your inputs for your personal and your institutional goals or professional goals. Honesty is always appreciated. You know, if you are not honest with yourself, or eventually it will be noticed. You know, so it's better to be honest and to be truthful. La próxima, next one, please. Of course, you know the city very well, no? It has been taken from the museum, I think. It's Philly there, you know. I can see the place where I live in Philly here. I love to live downtown. Now I changed, you know, from the suburbs to downtown. This is my new approach now. I like to walk. I don't have a car myself. I use public transportation. So this is a fantastic city. So I'm so glad that you are associated to the University of Pennsylvania. There's another one. Okay, the way forward now, retirement. Okay, I am 70 years old. I retired formally from PAHO at 62. But my personal philosophy is that you can have three options when you decided for retirement. The first one, you can continue doing what you know how to do. The second one is you can be a disruptor. You can start something very different, like I have started agriculture, for instance, buy a farm or doing some different things than the one I was doing. Or maybe you can have a mix of things, you know, that's the third way. So I decided to be an explorer, but also to do what I like to do and what I know what to do. I know what to do in technical cooperation. I know how to do it in international work. I know how to do in global health. So I'm doing that, but I do other things as well. So you need to combine things and see what you are good for. Keep your friends and make new friends. This is most important. You know, you never know where you need your friends. Friends are fantastic opportunity to day-to-day life and also to connect. We are in a world that is super connected now, so that gives us also a chance to keep friends even if they are physically located far away from you. And they enjoy every day, which is a good, the joy of vivre, as the French say, you know, is something that will keep you going. And then do not give up your dreams, you know, identify which one is your dream, don't give up your dreams, okay? I think I have spoken a lot now. Is there another one? Oh, well, yes, this is where I live now. This is the Panama Channel, and there's a ship there going across the channel. The channel, don't think that is just like a tube. No, there are very narrow parts of land that is really the real channel with some locks. They call it locks, and then around these locks there is a system of lagoons, little lagoons that feed these locks with water, and then the ships go through very narrow places that are the locks. So this is Panama. This is where I'm living now for the next ones. And visit me, okay? Now I'm open for any discussion you would like to have, questions or comments.
Thank you very much, Professor Dr. Sotelo. This was a very informative presentation, helped me understand how nonlinear the path of global health is. And, it gave really good advice to a lot of us soon to be graduates of the public health and the medical programs. So now I'll open the stage to the floor. Does anyone have any questions for Dr. Sotelo? Okay, Glenn, go ahead.
Hey, I'm Juan Manuel. Thank you very much for spending time with us today. I'm the director of the Center for Global Health here at Penn. I'm wondering if you could tell us a little bit about PAHO and the individuals who enter. You spent the majority of your career there. Do most individuals come to PAHO and then work their way sort of, say we have graduates finishing their MPH or maybe a medical degree? Would they come in early and work their way through the ranks, or do people come in at more senior levels? I mean, take us through, if you would, the sort of the career paths within PAHO.
Thank you, Glenn, for having attended this session, for having had the patience to listen to me. Anyway, PAHO is a very unique institution because it's older than WHO. Okay, it has 120 years of existence, and WHO was created after the Second World War in 1945. Okay, so PAHO is older. But PAHO, when WHO was created, was immediately absorbed as the American branch of WHO. Okay, so we are the regional office for the Americas of WHO. When you are in PAHO, you don't know if your salary is coming from money from WHO or from the quota contribution from the Americas. Yeah, it's for you to have this double nature. You belong to both institutions. Now, when I started in PAHO, the normal entry age was between 45 and 55.
Wow.
Because you were expected to have a national career, in national administration, and some international experience, okay? Now the entry age of PAHO is around 35 years old. All these reflect the changes that are taking place in the world of labor, in the world of the organization. Once you enter in PAHO, when I started, for instance, you are expected to have a career there, a long-term career. Long-term for someone that has entered. I entered very young. I entered at 32. It was unique in the time I entered because normally people were getting in 45, 50 years. So they remain until they are transferred to Washington. And in Washington, they tend to stay. They tend to stay in Washington because it's a regional office, and rotation to other parts of the world was not so easy at that time. So they tend to stay in Washington, and that was it, In my case, I came to Washington, but I wanted to go again to the field and so on, and I did work with Europe, with other parts of WHO, which was great, it get me richer, but it's not the normal pattern. Now, currently, some colleagues tend to move more horizontally as well, go to other WHO regions, go to Asia, to Manila, to Cairo, and so on, which is I think is very good because you get richer when you have this more horizontal type of approach. What else I have to tell you? PAHO is part of the Inter-American system, which is great because it gives you like having two hats. One hat representing the Americas, and the other hat representing the world as being part of the UN system, as a specialized agency of the UN. So, which is good also. In any negotiation, we will give you the two perspectives and also the type of solution you want to promote. We have government bodies in PAHO that are all the member states that get together to elect the director, to define policies and so on. But at the global level also, we have the government bodies of WHO. The countries of the Americas pay two quotas, one for WHO and another quota for PAHO, which means that they appreciate a lot the institution, because other countries outside the Americas, they just pay one quota to WHO. They don't have to pay quotas to the regional institutions, okay? So in the case of the Americas, they pay twice. Now, about the funding of PAHO, it's very important that you know that most of the fund comes from 6 countries: the United States, Canada, Brazil, Argentina, used to be Venezuela, one of the main contributors, but not anymore. Okay, and then the rest of the countries, and then countries like those in the Caribbean that pays very little compared to what the United States pays or what Canada
If
pays.
individuals are coming in more commonly now, say in their early 30s, what are they doing up to that point after they say finish their primary degrees? What sort of a typical experience, if there is such a thing, that somebody might have?
Okay, they finish their career, they starting normally immediately the postgrad training, and they get work in NGOs, in major NGOs for some years, or of course, they enter in the institution, so that gives the institution the opportunity to get to know them a little bit more. I have 3 interns, for instance, one from Egypt, another from Tanzania, another from Mexico. No?
Yeah.
This helps a lot, helps a lot for you to know the individual. So they work in NGOs, they work in the World Bank, IDB, and so on, and they switch to the UN system via PAHO or via other regions.
Great, thanks very much. Thanks again for the talk.
Thank you so much. So we are nearing the end of our first session. Dr. Sotelo, if you're willing to provide the participants with your contact information, so if any other questions pop up, they could send that to you. That would be really wonderful. And thank you again so much for being our speaker for this week.
It was my pleasure. You have my email, I'm sure, at the center. You have juanmanuel.sotelo@gmail.com. And Miranda is a good reference. She's still my student. Okay, take good care.
Thank
Thank
you
you.
so much.
Enjoy your
Thank
day.
you.
Bye-bye.
Have a great day.